We'll set up for some isometric reverse lunges with a 3-pound weight for lifting and chopping. Set up with your dominant leg in front, twisting over the front leg to the outside of the hip. Exhaling, bracing the abs to twist up on the diagonal, and then inhale to lower down back to the hip. Make sure there's weight in that front heel and that the back heel isn't down, that it's just the metatarsals, and the weight is evenly distributed between the baby toe and the big toe. So you're really using all metatarsals of the back foot. Nice right angle with the front leg with a lot of weight in the heel to combat the plantar flexion of the ankles. Make sure your chin is deeply retracted, double chin, chest reaches for the shoulder blades. Tailbone can point back a little bit, little lumbar extension. Give me one more here. And then we'll make our way to the second side, setting up and beginning once you have your balance and the weight distribution is correct in the front heel and throughout the 5 metatarsals in the back leg. Collarbone is wide, chin is retracted, belly's pulled in and up. Your focus is eye level, and when you twist, your head stays on your spine. Make sure your head isn't poking forward. That's usually a sign that you're gripping in the front of the chest. So if the head is forward, make sure you guide the chest towards the shoulder blades so that we get the upper back involved in this twist. And also take note if when you twist the torso, the pelvis is twisting. Make sure the bony protrusions of the hips are shining like headlights to the wall in front of you and they do not move. Finish up your last one. We'll go back to the first side and we'll repeat. Beginning on the first side, taking your time with the twists, feeling the weight in the front heel and evenly distributed through the 5 toes of the back leg. Notice when the head starts to poke forward, retract the chin. Remind yourself that the chest has to reach towards the shoulder blades as the shoulders plug down the back. The facial muscles need to be softened. And your exhale is on the way up. And your inhale is on the way down. I'm leaving it up to you to decide a tempo that you can work with control and awareness of your checkpoints. Stick your butt back a little bit so your tailbone reaches back. You have some lumbar extension. Finish up your last one on the first side, and we'll repeat the second side for the final minute. Setting up, weight in that front heel, and evenly distributed through the back 5 metatarsals, sternum reaching towards the shoulder blades. Close the rib cage, plug the shoulders down the back, retract your chin. Only twist on your exhale and inhale to lower slowly. Keep the head on the spine. This is a hard one to keep the head on the spine. The chin especially wants to poke forward from those overactive delts and pecs. Keep reminding yourself, chest reaching towards shoulder blades, upper back must be engaged. Shoulders plugged down the back, chin retracted. It's not about pace here. It's about the quality of the movement so that we correct poor movement patterns to improve your posture and functional movement. Finish up your last one. We're going to keep a hold of that 3-pound weight and we're going to grab our lightest loop band to bring around our ankles. We're going to be moving in the sagittal plane now, traveling forward and back. You'll load your lifted leg, holding that weight with a couple of fingers just to make sure it's secure. Inhale, exhale, pulse the leg up. 2, 3, 4. Inhale, exhale, pulse. 2, 3, 4. Inhale, exhale, pulse. 2, 3, 4. Repeating on the other side, stepping forward to balance, dorsiflex the foot that's lifted, tailbone reaching back, sternum reaching towards the shoulder blades. Make sure you're pulsing up on your exhales. Chin is retracted, collarbone is wide, shoulders are plugged down the back. We'll now step backwards to balance in knee flexion, setting the weight on the thigh. Inhale, brace the abs, exhale, pulse, 2, 3, 4. Inhale, brace, exhale, pulse, 2, 3, 4. And inhale, brace, exhale, pulse, 2, 3, 4. Last time, stepping backwards to balance in knee flexion, loading the thigh, holding it here. You do your pulses on your exhale, and I'll remind you of those checkpoints. Soft bend in your supporting knee, weight in the supporting leg's heel of the foot. Tailbone back, lumbar extension, collarbone wide, chest reaching for the shoulder blades, chin retracted, gaze of the eyes up eye level or a bit higher. Go ahead and set that weight and the loop band to the side. Coming to center, go ahead and take your dominant arm up in the air and grab the wrist with your non-dominant arm, stepping your dominant leg behind you if it's the same as your dominant arm, bending the knees and side bending in the opposite direction of your dominant arm. Press the pelvis forward here, holding it for this nice postural stretch. Inhale. And exhale, we're releasing the hip flexors as well as opening those tight intercostals and lats. You can retract your chin, turn it down on the diagonal or keep it center. 2 more inhales and exhales, using your exhales as a chance to deepen the stretch. Go ahead and switch sides, grabbing your non-dominant wrist with your dominant hand, pressing the pelvis forward, crossing your non-dominant leg back if it's the same as your dominant arm. Side bending away. Keep a bend in the knees so you don't topple over. It is a challenging stretch balance-wise. Push the pelvis forward to open up the hip flexors, but focus more than anything on the lateral flexion here, the side bending, and your checkpoints. Your chest reaching for the shoulder blades, chin retracted, abs engaged, pulled in and up. 1 more breath. Use your exhale to bring you back up to center. And you'll grab your chair and the second to heaviest Theraband for our final postural stretch. You're going to loop the band around the arch of the foot, dorsiflexing the foot, putting it on the chair, soft bend in your supporting leg, weight in the heel of your supporting foot, tailbone back, dorsiflexed foot, rowing with the outside arm, other hand on the wall, counter, or bar, or if you have the balance, you can hold the band with both hands and row. Just make sure that if you choose to hold the band with both hands, you're able to keep pelvic extension, lumbar extension. If you're rounding your low back, I'd prefer you to hold the wall to gain more control to move into the proper pelvic position. We don't want to exacerbate the chronic back pain that you've been experiencing. So pull the abs in, keep the chin retracted, chest reaching towards the shoulder blades, collarbone wide. You've got 2 more inhales and exhales on this side. And then I'd like you to set up for our final stretch. So bringing the band around the metatarsals, dorsiflexing the foot, soft bend in the supporting knee, weight in the supporting foot's heel, especially. Sternum reaching towards the shoulder blades, chin retracted. You're hinging forward into this central hamstring stretch, posturally tight area. We hold for a full minute. Remember, if you'd like to hold longer, pause the video, hold for up to 5 minutes, making sure that you're keeping the breath going and you're using your TVA contractions, the contractions of the deepest layer of the core, the transverse abdominis, which alleviates lumbar pain. So inhale through the nose to do that. Pull your belly button in as if you're putting on a tight pair of jeans. Lift up on the muscles that stop your stream of pee. Holding that lift, fog a mirror with your exhale as you deepen into that hamstring stretch. 1 more time. Inhale, prepare, belly button to spine. Lift up on those muscles that stop your stream of pee and fog a mirror with the exhale. Slowly coming out of the stretch. Great job.